We have talked. You see my screen now?
Mm-hmm.
Okay. We've talked about the diagnostic procedures we should do in order to diagnose the chest disease. Okay.
Mm-hmm.
Now we want to talk about in nursing intervention. What is the nursing intervention should do in order to help this patient? So the first thing we've said that, which is the most important thing in medicine, is uh, airway
Mm-hmm.
way patency. As a nurse, you should look for the airway and manage it. If the patient, for example, is uh, unconscious or get into coma, you should uh, put some tubes or something in their mouth in order to keep their airway patent. Okay.
Mm-hmm.
Okay. So what is the second thing to do is if the patient, for example, suffering from orthopnea or something, so try to position him or
Yeah.
position them. Yeah, position them in the right place. So you can put some pillows under their um um back, to enable them to breathe well. Okay. Yeah. So that's it. The priority here to maintain an open airway.
Mm-hmm.
Yeah. So what else you can do as a nurse? Yeah. You can add anything, Ryan? Okay.
Sorry, my computer. Can you hear me?
Yeah, I hear you now.
Oh, okay. I have to like close it and then I like lose shoot.
This is the
Your
intervention of the nursing where they come. First one, the maintain the
Oh,
airway.
elevate the bed. Yeah.
Now your voice is more clear right now.
Okay, good.
Okay.
Um, what was the question?
The question was, as a nurse, what is your nursing intervention in order to help the patient suffering from anything related to their chest?
Oh, yeah, you can position them.
Yeah,
Or,
that's right.
sorry, elevate the bed, or if you
But
get the
for
patient
first
up,
one, the maintain airway.
Yeah,
yeah, you want to make sure they have an open airway. That's priority. I think I remember
yeah, that's right.
that. But then you want to get the patient to move around.
Mhm.
That's what she means by ambulate,
Yeah,
I
that's right.
believe,
Yeah, that's
um,
right.
because that'll get the secretions to move. Um, and then I think the rest are about like the adding humidifiers, like and keeping the patient hydrated will make the mucus slippery, and the patient will be able to like excrete, like
Yeah,
cough it out.
that's right. Yeah.
Does that make sense, Wafa? Like pretend like, if I had a cough, I'm coughing, you know?
Like a coughing, so to get it off. Even I don't have cough, but I felt like
Yeah.
oh, so it's getting out.
Yeah,
Yeah, like
that's
when I'm in class recording lectures and people are coughing, I'd be like, drink a water, or like, or like,
yeah. So, what if you have done all those things and it doesn't help the patient? So you have to offer advanced interventions, right?
To put oxygen or put mask.
Like suctioning, yeah, suctioning, okay, and also nebulization, and lastly, you can put him on CPAP, as we said, or mechanical ventilation. Okay,
Okay.
that's cool. Now, what teachings you should offer to the patient? The most important thing is to stop smoking.
Smoking.
Yeah,
Yeah.
this is the first thing to do. Stop smoking, and
Like when
also,
they sleep and when they head up, not to sleep like flat way.
yeah, but I'm talking about smoking, Wafa, okay?
Mm-hmm.
Yeah, and breathing exercises, it also help, and effective cough, because cough is a defense mechanism that exhale any bad or any foreign bodies in our chest or our lungs.
Mhm.
Okay.
What is it? What does she mean by effective cough?
Effective cough
Like
means, you know,
you cough hard, like coughing is help you to clean your chest. It's good thing. Like
Oh,
yeah,
you
so
know,
the turn and cough.
you
yeah,
should educate the patient the best way to cough to exhale out
like
any
yeah,
pollutions or anything. Okay.
like when they cough and let's keep it inside. They try to let everything goes off. Like what she said, coughing is making cleaning your body. Just make sure to cover so not to spur your germ.
Yeah. You know that cough is a normal defense mechanism. It's not a bad thing. So if you're taking antitussive medications or something that may interfere with the action of cough. Okay. So make cough drugs as a last solutions. Don't start with it right away if you're
Okay.
زي
having.
دحين العطس, you
Okay.
consider coughing?
No, it's a
That makes
mechanism
sense.
too. Sneezing is a mechanism too related to respiratory system, but
Oh,
it differs from cough, wafa. Okay.
Mm-hmm.
your thing is connecting to my. Just turn it off because I don't.
What? What, Ryan?
I can't hear them now.
He talking with his roommate, so
Okay.
just continue.
Yeah.
You hear me, Ryan?
No, I didn't, but it's fine. I'm just going to. My roommate is using headphones and it was connecting to my computer, so I
Oh,
didn't hear.
okay. Now you hear us?
Yeah.
Okay. So that's it. And also, medication doses. Like, you should educate the patient about the side effects of cortisones or steroids, and bronchodilators, and the correct dose and everything related to medications. Okay.
Mm-hmm.
Yeah,
Okay.
that's
I
it. So,
remember she said to focus on the side effects, I think. Because
yeah,
some, yeah.
we will get through all the side effects of those
Oh, my
medication
bad. Okay.
because it's very important in exam. Okay.
Okay.
Okay. And also, you know that this is a slide. It comes after all the lesson. It's kind of away from the notes, but let's discuss it very fast. Like, what major causes of airway obstruction? First thing is bronchial smooth muscle contraction. So if there is any disease that contract our trachea and bronchioles, it may obstruct the airway. Like what? Like asthma, as we said, COPD. Okay.
So the asthma is considered as a upper uh
No, we said that
res-
it's not an upper, it's lower respiratory tract infection, not infection, disease. Okay.
لأن عبير قالت لي في سؤال جاي like this.
Okay.
تسأل which is disease is an upper.
Yeah, disease is an upper respiratory tract, as we said, common cold, uh, like pharyngitis, uh, tracheitis.
Rhinitis. Yeah.
Yeah, any of
Like,
Ask
these.
Shoma about it, Ryan.
oh, I can. I think I'll be able to explain that to you in person tomorrow,
Okay,
the difference between those.
Okay.
sure, sure. Okay.
So, what else? Mucus hypersecretion, like chronic bronchitis, also may obstruct the airway, and inflammation or infection like asthma or pneumonia. So anything related to lower respiratory tract infection can obstruct the airway. Okay, and airway obstruction is an emergency and it needs urgent intervention like O2 inhalation, and also given medication like cortisone and also beta 2 agonists. Okay. So now let's talk about medications of respiratory system. Okay.
Yeah.
Now, Ryan, we has two problems in our respiratory systems that may happen. The first thing is bronchoconstriction. Okay. And the second thing is inflammation. So if the patient has asthma here, so they suffer from what? Suffer from bronchoconstriction and inflammation too. So most of diseases has two side effects. So in order to overcome those two problems, you need medication. So the first kind of medication, it will be what? It will be bronchodilator. Okay.
هذا برانكو كونستراكشن برانكو
Yeah,
ديل يعني موسع.
bronchodilators. Yeah, that drugs that relieve this sign or
The
relieve this.
construction.
Yeah. And inflammation, we need to give anti-inflammatory, like what? Like cortisone, okay? Cortisone or steroids or glucocorticoids. So,
One have a question. She mentioned he like one of type of medicine. I don't know. I didn't hear about it. The girl she told us about it. One second, Ryan.
okay, what is it?
Like she said about what kind of medication?
Yeah.
Mm, you can continue. So she mentioned methylxemia,
What? Methyldansin, you mean?
methylxanthins. Yes,
Methyldansin, right? Or you can send it.
we hear. اسمه ميثايلكنزين. هذا الدراجز استخدم حق شنو؟ هذا
Uh,
أول مرة أسمع فيه.
no, no. We
شوفوا.
yeah, prednisolone, you mean?
ميثيكالينزينز.
Yeah, methyldansin. We said that methyldansin is an that thiophelin. Thiophelin. It's the same name, thiophelin or methyldansins. These drugs we
They
give.
consider as a cortisone.
No, they are calcium antagonist, or they are like having magnesium or something that block calcium and consider as muscle relaxant.
But why she ask us about it in the exam?
What?
Why she asking us about this is an exam? Because there
We
one question with the prednisone. Prednisone, what is medication?
prednisolone or prednisone is a steroid or glucocorticoid.
Steroid,
Yeah,
like cortisone?
yes, it's a cortisone.
Cortisone. Okay.
So
Okay. And the
prednisone,
medication that first say as a nurse when you give it this
yeah,
medication to your patient, you cannot stop it directly.
yeah,
This is
because
this is the same, yeah.
yeah,
And
it
the
you should,
one more question is calling about methicalism drugs.
yeah,
Why do you not use or giving it to patient?
yeah. Why don't we use it or give it?
But أنس أنت ما درستنا عنه ده الدواء.
Really?
ما أدري أسألك جد.
Yeah, we studied it. It was the last
About
one. You know that you remember that we studied beta 2 agonist
uh-huh.
and we studied the next thing it was anticholinergic and the third one is was thiophelin or methyldansin
This is the drugs used for what?
used as a bronchodilator. The third
Oh like
the
but
third
ليش
option
قالت هي ما تعطينه؟
بيقول لك methyldansin drugs why don't we use or give it to patients? Okay?
Why?
For some people because they have risk of toxicity, or I told you that it has a very, very narrow therapeutic range or therapeutic effect.
Oh ده mentioned لنا.
Yeah, I mentioned
صح.
this.
Yes. So
Yeah.
أسئلتها واضحة صراحة.
Yeah, it's pretty clear. I told you that this
يعني
drug,
سؤالها كان واضح. أسئلتها ما
yes,
كانت يعني أسئلتها ما كانت صعبة للي مذاكر حافظ زي اسمه. أنا
yeah, I
مش
see.
حافظة.
We said that this drug has a very narrow therapeutic effect or therapeutic range, so there is a high risk of toxicity. Okay, so it's better to avoid these medications. But if the patient, we give him beta 2 agonist and also steroids, and we give him anticholinergic, but there is no improvement, so we can use it, but under precautions. Okay?
Oh, that's why we didn't give the therapeutics.
Yeah.
The her question is so clear. Like really, it's not that
Yeah,
complicated.
it's not that hard. Okay.
It's just you need to. That I know this professor. She love medication. She
Oh,
always
yeah.
make this check.
Which is important, by the way, because medication is very important to master.
Yeah, thanks God I didn't go to the exam because
Y
I'm not ready.
yeah, you got it, Ryan?
Ryan busy with his roommate. Don't worry. He listen. We make it record the meeting.
Okay. So it's okay. So
Continue.
okay, let's talk about now about what about uh medications, okay, Wafa?
Yeah.
Yeah, the first one we said the first family, it's what? It's uh
Beta 2.
no, broncho. I mean the family bronchodilators.
Bronchodilators.
Yeah, we have three options. The first one is beta 2 agonist, okay? We have two types of those. The first one is SABA and the second is LABA, okay?
Lava.
Yeah, SABA means short acting beta 2 agonist. And this is very have has a very short half-life, okay?
Mm-hmm.
Very short half-life.
Life.
So it's very
Saba. Like a Betroin.
yeah, albuterol.
Albetrol. Betrol.
Albuterol. So it's a very important as a reliever, not
Yeah.
controller. So we
So
give it
this is giving only IV?
no, it's inhaler.
Inhaler. Okay,
Yeah.
sure.
Okay. It's we give it as a reliever, not a controller. So patient can
Okay.
take it in emergency cases or if there is acute asthma or something which is
Mm-hmm.
very acute because their
Mm-hmm.
half-life is just from 30 to 60 minutes. Okay.
Mm-hmm.
While LABA is a long-acting like salmeterol. It's
Mm-hmm.
important to know this name is a long acting and have a long half-life. So it's controller. Okay. What is the meaning of controller? The patient can take it,
At
outpatient can
home.
take it at home, yeah, to control their disease. Okay.
Mm-hmm.
Okay. The second choice is what? So no, before getting into the second choice, the first choice, what is the side effect of this drug? Yeah, it's an sympathetic, right?
Sympathetic, like bradycardia.
No,
No,
sympathetic means
tachycardia.
yeah, like tachycardia,
Tachycardia.
tachycardia. The patient may
Uh,
suffer from
confusing.
no, not confusion. It's tachycardia, like palpitation.
Yeah, palpitation and cerebration, I think.
No, it's tremor.
Tremor.
Yeah, tremor.
Tremor, what's it mean?
رعشة أو إن إيده
Mm-hmm.
كده تترعش. And
Mm-hmm.
also insomnia, maybe like, an anxiety symptoms. And
Mm-hmm.
also, lastly, the patient may be more sweating. There is more
Mm-hmm.
sweating. Okay. Okay.
Mm-hmm.
So the second choice is what? Is anticholinergic drugs. But you know that it's not widely used, anticholinergic. We focus more um on beta 2 or corticosteroids, okay? So
Corticosteroids, what do you mean?
corticosteroids or steroids is cortisone or prednisone.
So now we're talking about two. This is
Yeah,
to
this is the
die
second drug. It's anticholinergic.
anticholinergic. Yes.
Yeah,
What is the drugs under this one? So you
it's
didn't give
it's
me example for LABA medication
yeah,
like
I typed here salmeterol.
Salmeterol,
Yeah, but for SABA it's albuterol.
albuterol. What is the effect for the other drugs?
Those drugs have the same side effects because both of them
Okay.
are beta 2.
Okay.
Okay.
Two.
Okay, that's cool. Okay, now shift to
So that is
anticholinergic drugs. What is the name of this drug? It's named ipratropium. Okay.
ipratropium.
Yeah, we use it mostly with COPD.
COPDs.
Yes. Okay, that's cool.
Chronic
Chronic obstructive
obstruction
pulmonary disease.
pulmonary disease.
Okay.
Mhm.
This is ipratropium bromide. Now what is oh, this is anticholinergic drugs. Now, what is the side effects of these drugs?
Which drugs? What the name of the drug? Sorry.
Ipratropium. tropium
Ipratropium.
bromide.
Bromide. Ipratropium bromide.
Okay.
Mm-hmm.
What is the side effect of this drug?
Mm. Uh, mm, Pulsing, maybe?
What?
I don't know. Maybe the
Uh,
same.
you know that side effects,
See?
it's like atropine, okay?
Mm-hmm.
So the patient may suffer from dry mouth, right?
Mm-hmm.
Dizziness and blurred vision, okay?
Blurred version.
Yeah, because
Oh, yes, because this is
yeah,
antagonist.
yeah, it
Shit.
acts like dry mouth disease. It acts like atropine,
Mm-hmm.
okay?
Mm-hmm. Yes.
Okay. Now let's move to the last family. It is what, Wafa? It's
It is the
yeah,
one she bring it in the exam.
yeah, that's right.
Theoretics.
Yeah, methyl dancin or methyl
It's
dancin.
considered anti what?
I will tell you.
She.
Methyl dancin or thiophelin. Okay,
I'm gonna go
both.
with the name she gave the.
Yeah, both are the same. Yeah, in your exam, she may use this name. Okay, so
Mm-hmm.
don't depend on this. Just save the both names. Okay.
Mm-hmm. Mm-hmm.
So those this medication, it act as what? It act as a muscle relaxant.
Mm-hmm.
Okay,
Mm-hmm.
it's neither beta 2 agonist nor anticholinergic. It's a specific type. Okay, it doesn't relate to sympathetic or anti cholinergic.
Mm-hmm.
Okay, okay. So what you should understand or you should know about this. The first thing that this medication found in some drinks like coffee. Okay, so it's very important to tell the patient not to drink too much coffee if they are taking this drug because it will increase the effect of this drug. Okay,
Mm-hmm.
yeah, that's so important.
كان بقول لي ايش قالت المصل ريلاكسيشن يعني خلي المصل يرتاح ويقعد كده
Yeah,
نفسه يصير كويس.
it's a bronchodilator too.
Okay. So
Okay.
which is the side effect حقه?
The side effect
The therapeutic intake is too slow.
yeah, this
هذا
is
أول حاجة.
yeah, this is the first thing. The second thing is that it's found in some drinks like coffee. Okay,
Uh-huh. And
so
it's gonna make it
yeah, it's found in coffee. So if the patient is taking coffee or drinking coffee too much, so this may affect the drug, okay, and
mhm,
increase its toxicity. And also, it has a narrow therapeutic effect, okay? So this narrow therapeutic effect makes the drug liable to be very toxic.
mhm,
So the narrow range is just maybe 5 nanogram. So and its
mhm,
toxic dose is 35 microgram, okay?
mhm.
35 microgram. You should remember this, okay? You got it?
Yeah. So
Ryan.
معلش عيد أول حاجة. أول
Uh,
شيء إنه النيرو therapeutic intake the side effect
yeah.
والسايد الثاني
The second one is it's found in coffee.
is
So
maybe is gonna make it worse or
yeah,
maybe make it the therapist intake worse.
yeah.
Or maybe in this question, if she told me, don't tell the patient why you didn't give it because it's make with the coffee and ولا الأول
No, no,
اللي هو
they must.
النار.
No, no. This is not a big deal. If you will give it to a patient, just advise him to not drink coffee. But
اوكي بس انا دحين بسألك عن
yeah,
السؤال
yeah, I
اللي
know, I
سألته
know,
في
I know, I,
الاختبار.
I know now.
So which one I chose?
You choose the most effective one, which is narrow.
No.
Yeah, this is not a cause.
Why you not give it or give it? Okay, yeah, she asked قالت ليش ما تعطينا أول why.
Yeah, yeah, you shouldn't it's we fear to give it to patients because it has a narrow therapeutic effect. So patient may get toxicity so easily. Okay. Okay, now let's move to our last choice, which is what? It's cortisone or glucocorticoids. So where
Mm-hmm.
this comes from? It comes from our naturally are from our adrenal
Mm-hmm.
glands. Okay.
Mm-hmm.
So adrenal glands secrete cortisone. So
Mm-hmm.
if you give the patient cortisone from outside, so it will
Mm-hmm.
affect this gland. This gland will not release more cortisone, right?
Mm-hmm.
And this will lead to what? If you stop this medication uh, as a one shot or
Mm-hmm.
suddenly, the patient will suffer from something named adrenal
Mm-hmm. Mm-hmm.
crisis.
Mm-hmm.
This is so important, Wafa, because she may ask
إيش-
about this.
What he ask
Your tutor may ask about this in exam.
about
What?
what?
Yeah, adrenal crisis.
adrenal crisis يعني ايش؟ يعني قلنا له انه يعدم يعدم
Yeah,
انه ما عاد تشتغل.
yeah, that's right. ما عادش تشتغل وانت وقفت الدواء مرة واحدة. تمام. انت وقفت الدواء من بره مرة واحدة وكده كده الغدة مش شغالة فالمريض يدخل فيه adrenal crisis.
adrenal crisis.
ماشي. تمام.
هذا اول شيء السايد افكت.
لا بالظبط ده اول شيء. تمام. تمام يا
اوكي.
وفاء. طيب.
يا
adrenal crisis, what is the the side
هذا لو
effect.
وقفته دايركتلي، عشان كذا قالت لك هو اول شيء لما تعطينه ادويه ما ينفع يوقفه،
Yes, that's right.
لان
So
هذا is dependent this. اوكي.
yeah. So what is adrenal crisis? The patient will suffer.
adrenal crisis when he
Yeah,
stop taking the
yeah. When
cortisone
when when you
and then
stop.
without
Mm.
the time it's called temporarily. انت قلت لنا كلمه
Yeah, كلمة اللي المفروض ان انا اسحبه gradually tapering.
tapering.
Yeah.
اكتبها لي.
اهي الكلمة دي مهمة جدا tapering. Okay.
yeah.
Okay. So this is important. So what is the symptoms and signs of adrenal crisis? The patient will suffer from severe abdominal pain. Okay.
abdominal pain.
Yeah. It also will suffer from severe headache.
severe headache.
Yeah. Confusion.
Mm-hmm.
Also, he will suffer from hypotension.
hypertension.
Yeah. So these are signs and symptoms of this adrenal crisis. So the patient will not able to tolerate these symptoms. So
Mm-hmm.
he should return back again to cortisone, which we call it as a withdrawal
Mm-hmm.
withdrawal symptoms. Okay. أعراض الانسحابية.
Mm-hmm.
You got it?
يب.
Yes.
معلش عيد هذه النقطة. أول حاجة إنه في الكورتيزون لما ياخده بيعالج إيش؟ أنت ما شرحت لي إياه.
What?
هو نوعين، قلت لي انهيلر
Yes, we will get into this, but just focus with me about this now. I will get it
about the
into the
side effect.
yeah, because it's more important than using the track.
Okay, the side effect is this make a adrenal crisis. معناته انه هو يوقف شغل الكلى لو انت وقفتيه فجأة، وبعدين يعمل سيفير لو صابت معاه هذه الحالة اللي
Mhm.
هي الكرايس. ادرين كرايس
Yeah,
يصير معاه سيفير abdominal pain and headache
right.
and confusion and مايو. ايش
Yeah,
هذه؟
confusion and hypotension.
hypotension يعني انخفاض ضغط الدم.
بالضبط.
so yes. وبعدين
So now for that reason you should taper it gradually, okay?
gradually.
Gradually. So this is the most important note here. So what
Mhm.
else? What else? The patient will suffer from something called Cushing syndrome.
Cushing syndrome. هذه شيء
Yeah, what is Cushing
oh,
syndrome? It means that the patient have
Cushing's
taken too much cortisone from outside. Okay? Ma-
syndrome هاي تحسب as a side effect من
Yeah, of take.
الكورتيزون.
Yeah, that's right. You know that Cushing syndrome and adrenal
like
crisis.
face moon.
Yeah, not face
هذه
moon. It's
سألتك عنها.
oh yeah,
مهم.
moon face. You know
بس
that
هي اسمها علميا هذه
Cushing
Cushing
syndrome.
syndrome.
Yeah. I want you also to know that Cushing syndrome and adrenal crisis هم هم يا وفاء الاثنين دول عكس بعض بالظبط.
مش يعني
فاهمني؟
عكس بعض.
يعني الادرينال كرايسيس بتحصل ان مفيش كورتيزون خلاص في الجسم.
يا والثانية في too much cortisol في الجسم.
برافو
يس.
عليك، برافو عليك. دي الاولى، دي التانية دي اللي هي الكوشنج، هتلاقي معاها دايما هايبر تنشن. لا دي معاها
هايبر.
هايبو
عالي
تنشن. اه
هايبو.
دي معاها هايبو. هتلاقي دي
مهم.
معاها المريض مليان اديمة، ده المريض هنا هيكون رفيع، وهكذا. فهي عكسها بالظبط تماما.
مهم.
اوكي.
مهم.
طيب.
مهم.
What else the patient may suffer from? It may suffer from hypertension, we said it, and
مهم.
diabetes mellitus. What?
and osteoporosis.
Yeah, that's right. Osteoporosis. Porosis. Yeah.
Osteoporosis.
Yeah. What else? What else? Hypokalemia.
هايبوكاليميا اللي هي ايش؟ too much
Decreased.
water.
No, decreased potassium.
اه لانه هو يعمل لوس
Yeah, that's right. That's right.
يعمل لوس للبوتاسيوم.
Yeah, in order to save sodium. So it will excrete potassium and save sodium. Okay.
لان عشان كده تحصل معاه هذيك فيسموه من الصوديوم العالي.
Yeah, that's right. And also the patient will suffer from hypocalcemia. Low,
هايبوكالسيميا.
yeah, low calcium because steroid will interfere
with
with
the yeah.
calcium absorption. Okay.
Yes.
Yeah, so that the patient, as a result of decreased calcium, the patient will suffer from osteoporosis. Okay.
Mhm.
Yeah, that's it. So now let's move to what types of cortisone or glucocorticoids.
Mhm.
You should also remember the name prednisone because prednisone is also a cortisone.
cortisone.
Yeah.
Anas, please, I want to ask you a favor. I want you to do it nice chart and to put all the note and the side effect as the professor mentioned it.
Okay.
Please.
Yes. Okay. I will do it.
For
So
respiratory and for the
prednisone. Now let's talk about steroids. Yeah.
steroid.
As a
Steroid هذا
types.
mean
As a type. No, steroid is cortisone as we're talking about.
اسمه ايه steroids
Steroids
بس.
or cortisone or glucocorticoids
Mhm.
all have the same meaning. Okay.
Mhm.
So no, now they are maybe taken orally or inhaler as an inhaler. Okay.
Mhm.
So what they are used for, we use them for lots of things like
Mhm.
asthma, okay, COPD, and also we use them
Mhm.
for immunological diseases. Okay.
Mhm.
Yeah, that's right. So, what else you can mention as a side effect? I forgot a side effect which is very important. You remember it?
What's it?
It's candidiasis or oral infection.
oral infection and inflammation.
Yeah, or
ويعمل للميونم
oral infection.
للسيستم.
Yeah, oral infection. It named candidiasis.
كانديديز يعني ايش؟
التهاب فطري في الفم.
كان
Candida is a فطر, is a fungal
yeah.
infection. And
Mhm.
also it will cause immune no suppression.
immunosuppression.
Yeah,
لأن كلها هي لها different side effect.
yes.
طيب
And
هي حتقول لي oral ولا تعطيني اسم الثاني له؟ ايش الاسم الدواء الاورال اللي ناخذ؟
oral prednisone.
بريدنيزون.
Yeah, and Exhaler it named Farcolene or Palmicort.
Mhm.
Palmicort. Okay. She will mention
Mhm.
the name بين قوسين يعني زي ما هي بتعمل. Okay.
حتقول هي oral؟ مستحيل تمشينا كده.
No. It is all oral and inhaler, all of them make the same side effects, but the side
Mhm.
effects in oral are more severe.
more
Yeah,
more.
because we call it systemic,
Mhm.
or we call it oral or systemic. They have the same meaning. Okay.
Mhm.
Oh, that's cool. Uh, that's it. We finished.
Really?
Yeah.
This is all the side effect? But as I
Yes.
want from you, I'm gonna listen to her lecture again and I'm gonna go over her note and try to study again. And try to remember all the name of the drugs
Okay,
and the side effect. I'm
yes,
gonna like try to memorize everything good.
that's
And I
really
want you to help me with a good note,
okay.
please,
I will
Anas.
make good notes for you, but you know that tomorrow we will get into our IV.
Lab. Lab.
Yeah,
Tomorrow
lab
is gonna be
stuff.
lab.
Lab stuff. Yeah.
Yes.
Okay.
Okay.
Ryan, you hear me?
Yeah, yeah. Can you guys hear me?
Yes, we
Yes.
hear you. You understand?
Yeah,
I
it's
kind of
very
got
nice.
lost at the end, but I was
But
adding.
I'm gonna send you the record. You can hear it, Ryan.
Okay. Okay.
So
Send
Ryan,
me the record for all today.
Ryan, sorry, wait. Ryan, when you got lost, at which note
Oh,
or which information?
oh, I was just adding no notes like the steroids for cortisone, like the oral
Yeah.
infection,
Did you
candidiasis.
put her the same Anna's side effect?
But I can just re-listen to the this
Because I give the Anas the transcript and he put the same what the professor said. So I don't want to use general side effect from outside because she has her own word or own things.
Yes.
Like every doctor is different. Like he see the side effect in different way. That's what I find out. Like you cannot be independent in ChatGPT to take information from it.
Yeah, that's right. You know that Ryan, she wants to say to you that all the information I say, I got it from the script and the notes of doctors, okay?
Okay.
Yeah.
He
Yeah.
listened to the lectures and he
Yeah,
read the
I
transcript
listen to the record and read the
and
transcript and get into notes first before discussing this with you.
Okay.
So now, because our meeting is about to end, before getting into lab stuff, I will repeat the medication again for you, Ryan, okay?
Are you sure? Because
Ye- It will be
okay.
tomorrow. Yeah, before getting into lab, I will
okay.
review medication with you again, okay?
Okay.
Sure. But tomorrow I want the lab to teach me very well, like to
Yeah.
make
We will master lab stuff and we will review medications again, okay?
sure.
Okay,
But
perfect.
please أنس اعمل لي chart please please حق
But by
الأدوية.
the way, Ryan,
Yeah.
recent studies have approved that fasting decrease migraine attacks.
Oh, well, I maybe need to try it then.
Yeah.
That's
Okay.
good to know. Thank you.
Okay. Well, welcome.
Okay أنس please اعمل لي good
Yes,
chart note
I will do it. Okay. Okay, we'll do
because
it.
I don't want to study from the people.
Okay. Okay, Wafa.
Like no, like you know what you mean.
Nice.
She mentioned what she said. This is the professor. It's clear what like her question. If you paying attention to what she's saying in the class and you read the transcript and side effect, she will bring what she said.
Okay.
Even she turn change the way
But
of the question.
you understood today well?
I understood, but I need to memorize to
Okay.
make good memorization.
Okay. So until then, okay?